to Mom in Mind. I'm perinatal psychologist and host Dr. Kat. There's more to the story than just postpartum depression, and this podcast aims to share it all, from personal stories and lived experience to experts who break down the ups and downs of life from getting pregnant, pregnancy, perinatal loss, and postpartum adjustment to parenthood. While this is not psychotherapy or medical advice, it is all of the stuff you ever wanted to know about mental health and new parenthood. Welcome back to the Mom in Mind podcast. I'm your host, Dr. Kat. On our episode today, we are joined by Hadra Katti. She is an educator and perinatal mental health advocate and has worked for nearly 2 decades to create awareness of perinatal mood and anxiety disorders and support those experiencing these issues. She is on the Postpartum Support International Advisory Council, and her writing on mental health has appeared in various national media outlets. She does a lot of advocacy work, and she's going to talk a little bit with us about some issues that she's found negatively impact racialized perinatal women in particular, and also her role as a Muslim parents coordinator for PSI, and some other great insights on how we view perinatal mental health. So let's meet Hadra. Welcome, Hadra. Thank you so much for being with us.
Thank you for having me on.
Happy to talk with you. I was really excited to recently meet you at the PSI conference, and definitely I have become more and more involved in the PSI world with newly being on the advisory council. And I just definitely wanted to have you on to talk about your work. So how did you get involved with postpartum mental health work?
So again, thank you so much for having me on, and I really appreciate this opportunity. I got involved, I would say, about over 20 years ago. I got pregnant and I was having my first baby, and I was excited and happy, just like pretty much a lot of moms would be. But after I gave birth, I started to, feel really sad and down, and I started developing anxiety, and a lot of scary thoughts and stuff like that happened. Yeah. And I remember being like, I don't know what's going on, but this, doesn't really feel like me. And I went to the doctor a couple of times to try to figure out what was going on with me. But, I never managed to get any type of diagnosis. I didn't get help. And, after a couple of months of experiencing these kinds of issues, I kind of just got better on my own. Didn't think much of it at a time because, in hindsight, when I thought about it, I was like, maybe it was because, mental health wasn't really on society's radar like it is nowadays, right? So I kind of figured that maybe, the reason that I couldn't really get to the bottom of what was wrong with me was because of that. And I didn't think much of it for a bunch of years. But then a couple of years later, several years later, Brooke Shields and Tom Cruise had their really public fight about Brooke Shields' postpartum depression. I don't know if you remember that, but
I do.
Yeah. So they had their really big fight where Tom Cruise, was lambasting her for taking her decision to take antidepressants to, deal with her postpartum depression. And, he was basically calling her an irresponsible mom and saying that moms with this kind of thing should be taking vitamins and minerals and giving a lot of unsolicited advice. And it was around that time as well that a friend of mine developed a postpartum mood and anxiety disorder. And she had trouble getting help. And so that's combined with the Brooke Shields thing and the fact that, I hadn't really gotten a diagnosis of what was wrong with me. They all kind of came together and kind of made me realize that, postpartum depression is still very kind of stigmatized. There's a lot of shame around it.
Right.
People are still having a lot of trouble getting help. So I wanted to be part of the solution to that. And so I came across Postpartum Support International and all the great work that they do. And I decided that I wanted to, get involved and try to help connect moms to resources and just be there for them as they were trying to navigate this difficult point in their lives. So that's how I kind of got involved in it.
Yeah, I think there are a lot of people who, like me too, who have had a personal experience, and it kind of propels them into this specialty and, supporting and advocating. But unless you've been through something like this, it's hard to, I guess, either one, have perspective on just, how difficult it can be and how disruptive to life it can be. But also having people to be able to sort of advocate and talk about it so that people who don't know what's going on can realize what is going on, for the people they care about and that. And it just takes all of us really to be able to, the collective of all of our voices, not only to speak up for other people who are going through it, but also the family members who are trying to be supportive or who don't know what's going on. It takes so much education and getting the word out there. So you said that the 20 years is a good long time to be in this field, especially with how much it has changed over time and how much more information is getting out there. How do you see, what's your perspective on like how far we've come and where we still need to go?
Oh, I think we've made tremendous strides because like I remember when I was first a coordinator with PSI, I believe I was like the only coordinator in the Ontario area. I'm from Canada. And now we have I think 15 Ontario coordinators. Oh. That's like a huge number. And I remember even like pre-COVID, I was averaging, I would say about 3 calls a week, to connect women to resources and stuff like that. And now I kind of get maybe 1 call a month. And that's why I branched off into being like a specialized coordinator and stuff, because that just goes to show that to me, at least, that we've made tremendous strides. We have more people, willing to be peer support people and connect to resources. So, I think we've come a long way, and there's a lot more articles being published on this topic. I have a Google Alerts and I see it all the time. So it's amazing the amount of movement we've made with respect to this topic.
Yeah, that's so great to hear. So because there are so many more coordinators in your area, how big is I don't have any perspective on how big Ontario area is.
I'm not very good with things like that, but I do know even in Toronto, which is a main city, we have hundreds of thousands of people just in the Toronto area, and Ontario is and that. Yeah.
Yeah, that's great. I've been hearing a lot about how much more Canada is expanding, and just in terms of PSI expanding throughout Canada. And it's so nice to hear that so much more support is available. Because that is a lot of pressure if you're the one coordinator for that whole region it's hard to be a coordinator and get people to resources when there are not a lot of resources.
Yes, exactly. Or just, trying to be there to support them too. Especially if there's not a lot of resources in their area, then, or support groups or anything like that.
Yeah, absolutely. So, okay, great. I love that there's been so much progress in your area. So what are the other things? I know you've done some writing, and what are the other areas of perinatal mental health that you've gotten into?
I do a lot of writing. I also have advocated for the creation of postpartum support services in my area. So I was part of advisory groups at local hospitals and stuff like that, where I would advocate for the fact that there was no reproductive mental health facility in the catchment area and things like that. And I was part of groups that created some programs for perinatal moms. So I've been doing that kind of thing, just a lot of community presentations and stuff like that, going to my local mosque, midwifery groups and things like that, and just presenting on the topic. I've been invited to present to university medical student associations and stuff like that. So just any kind of opportunity that I get to share information about perinatal mood and anxiety disorders, I'm willing to take those on.
That's great. And I know one of the areas that you write about and talk about is the impacts on racialized perinatal women. And for people who might be new to that term, racialized, I'm wondering if you could start there, and then we can talk a little bit more about the things you've written about.
Yeah. So in terms of racialized, talking about people of color. So just anybody that's a marginalized group within society, that are people of color. And, there's a lot of barriers that people of color experience in terms of accessing help and things like that. So, I've written about that. I've also written about the fact that, it's not just with respect to perinatal women, but, just racialized people in general in mental health, in a mental health kind of setting, or with mental health, having a mental health crisis are, very differently treated than non-racialized people. So issues like that is what I like to talk about. And, I wrote something recently about the fact that, over the past year, there was another number of tragedies that occurred across the United States with mothers apparently seem to be suffering from postpartum psychosis, taking the lives of their children. And it really saddened me when I saw that even within the perinatal mental health community, there was so much light shone on the Lindsay Clancy case, which was very devastating, with her taking the lives of her 3 children, but was pretty much ignored the fact that there was all these, Black children who similarly suffered a tragic fate like them at the hands of mothers who were experiencing perinatal mental health crisis. And, nobody really talked about that, or nobody really pushed that as examples of what can happen when a perinatal mood disorder is left untreated. So, those are the kinds of issues I like to shine a light on.
Yeah, and I really do appreciate you bringing that in. I know that was a topic of concern and discussion, I guess within some of the PSI circles. And to your point, yes, it is important to be talking about the Lindsay Clancy case, but because of so many reasons, other people who maybe don't have, with the writing that you did just around that particular writing, what do you find, what's the reception? Are people writing into you and with comments or with thoughts, or are you getting anybody who's with the writing about those cases in particular, are you getting any feedback or people writing into you? What kind of reception is it getting?
Yeah, I was pleasantly surprised. I did get a lot of feedback, and people were like, wow, I never really thought about it until you mentioned it. I didn't even know about those cases. And can you give me the names of those women and things like that? And so I was happy that nobody was kind of like, why are you bringing this up? So that was good. And I mean, it had a hint of sadness in the fact that people didn't even know the names of those women. But I like to think that because I raised the issue, and I've been raising the issue at opportunities that I get, I hope now, people are going to be more primed to kind of look out for these kinds of things. And I have had some people that, some cases that I didn't even know that involved racialized women, people now send it to me and they're like, hey, did you see this one? So that's kind of good. I feel like I kind of made people put on their reading glasses a little bit better to kind of see these things. And people are pointing out themselves of things like, hey, it's being twisted as a child abuse case rather than a maternal mental health issue. Whereas, when the woman was non-racialized, it was talked about more as a maternal mental health issue. And so I think that, people are starting to zoom in on it. So that's a good thing that's happened, I think.
Yeah, I'm glad you brought in that point and that perspective, because I was going to ask you about it, that what have you seen just in, the looking into it that you've done, the writing about the different women's stories, how differently it's characterized, and if you can offer your thoughts on the why for it's characterized in such different ways.
Yeah, so it's completely characterized very, very differently. There's a lot more sympathy when the person is non-racialized, and the focus tends to be maternal mental health. What could cause a woman to do this type of framing. Whereas when the cases were racialized, it was more about the discussion was centered around the fact that some of these women were homeless or lived in shelters or were divorced, as if these things, as if those women kind of took their children's lives because, it was just hard. It was just mothering in these circumstances was hard. And that's why I was kind of really deeply hurt when the voices of fellow advocates and stuff was kind of silent, because I was like, no, we got to reframe this as a maternal mental health issue, because if you actually look at the stories, you can see that these women were buried in the stories were things like the women were hallucinating or they were delusional. And those are important to understanding that it was a maternal mental health issue. So I personally just think it's just more racism. You know what I mean? Mm-hmm. It's easier when the person lives in a beautiful house with a white picket fence around it. It's easier for people to identify with that than, something else. Right. So it's oh, wow. I'm a teacher. She was a teacher. I have 3 kids. She has 3 kids type of thing. And then we might look at other cases and be like, well, she lived in a shelter, and that's what sticks out as a sore thumb. So I think that that's what it is. We look at things that we can, more so identify with. And that's not fair because, all of these things have the same underlying issue. And if they had gotten help, they also wouldn't be in that kind of place, right?
Oh, absolutely. Yeah. I mean, you're also speaking to, as you were saying, racism and just in general about, and how some supports are systemic reasons that some supports are offered to some people and not to others, or more available to some and not others. Just kind of speaking more broadly about all perinatal mental health, what are some of the issues that you find impact racialized women?
Well, a big one, I think, is lack of access and a lack of access to quality care. I mean, although this kind of impacts everybody, it more so impacts those that are racialized, because I think the statistics are something like 1 in 10 Americans doesn't have health insurance. And we know that racialized people are overrepresented among this group, this population, for various reasons like systemic factors and racism and all this kind of stuff. And I find like in the work that I do with PSI in terms of trying to help people, what this leads to is that like even when mothers are having concerning symptoms, because they don't have health insurance, they want to take more of a wait and see approach. And depending on what their symptoms are, this can lead to very dangerous outcome. Like, if the person is like hearing voices, like that's immediate, like go to the hospital. But if you take a wait and see approach, you might not have a lot of time to wait and see what happens, right? And so even when I'm able to arrange something or facilitate something so that they can be seen by somebody, then, the lack of insurance concerns creates this well, what about follow-up care? How am I going to pay for the medications? And so it's not like you can even one time get them into somewhere. Like they have all these issues about why they don't even want to go to that one appointment to check out what the issue is. So it's a real issue. And then some people will be like, well, you know what? There's Medicaid for people who don't have private insurance. But I recently learned that that's not really the case, because there are some people that don't qualify. There's financial and non-financial criteria you have to meet. And there's a bunch of people that don't even qualify for Medicaid. And then even for people that do qualify for Medicaid, there's the whole issue of how there's not a lot of specialists that sign up to be Medicaid providers, because the pay is less and things like that. So, and then I found out that this is especially the case for psychiatrists. There's not a lot of psychiatrists signed up to be Medicaid providers. And that's because the psychiatric issues, they tend to be severe, complex, and chronic in nature. So they don't want to sign up to be Medicaid providers for that reason. And so that's why I say there's the lack of access to care, lack of access to good quality care for those relying on Medicaid. And, this is not just an American problem. In Canada, we have universal health care. And so which means that you can be seen by a doctor and even a psychiatrist, and that's covered by the government. But then there's women that will contact me and maybe, they've been screened by the psychiatrist, and the psychiatrist is like, okay, you're not at the point where you need medication, but you would benefit from psychotherapy. And we all know that CBT is amazing for even serious cases of postpartum depression. Then when I'm like, okay, I can find you this perinatal mental health certified psychotherapist, people are that don't have insurance because our universal healthcare doesn't extend to psychotherapy services. Then they're so it doesn't extend there. So it's then they don't want to, go to benefit from that. And it could really benefit them, because we know that maternal mental health issues not only takes an impact on the person having it, but the family, the child, everything. So, I see that hesitancy there, and that's sad. And, it doesn't have to be this way, because England, they have the NHS and they have universal health care, but it also extends to psychotherapy services. So, you know what? Canada is doing it a little bit better than maybe America, but there are still places out there that are doing it a lot better than all of us. And I think that is an issue that really impacts racialized and marginalized people a lot more. I mean, it does, again, impact everybody to some extent, but I see it particularly in those groups.
Yeah, I thank you for speaking a little bit to the healthcare system in Canada as well. It's not something I'm super familiar with, but, there's obviously in the US a lot of, if we had universal healthcare, it would fix a lot of things, and maybe it would fix some things. But what I am hearing across the board, even from the little bit that I do know, is that the waits for help are so long. Even if you have insurance, the waits are really, really long, and it's impacting people across the board. But certainly, even let's say sort of all things being equal in terms of, let's say, socioeconomic status, career, and whatnot, even if those things are on the same playing field, racialized perinatal women are still getting subpar treatment. Has that been something that you touched on too in your writing?
Plan on touching on that. One other issue, even with you're just saying socioeconomic status, all that kind of thing being equal. Another area that I see, racialized women being racialized and immigrant women particularly being negatively impacted is in the area of, or it's with respect to the fact that there's no universal screening for perinatal mood and anxiety disorders. And because of this, I think that racialized and immigrant people in particular are negatively impacted because a lot of times, like if you come from a culture that conceptualizes mental illness differently, it can mean you actually don't know about your family history of mental illness, right?
True.
And if you come from a country that didn't have ready or easy access to mental health services, again, you may not know your family's mental health history. And if screening tools are used for people with known risk factors, you're missing a whole bunch of people that just don't know their risk factors, right? And so that's another way in which I see like what we're doing right now can be radically improved. Just, literally like when I was like first getting into perinatal mental health advocacy work, I was like, I noticed that I had never been screened the times that I went to the doctor. And I was like, what is this screening tool? It must be like something huge. And then I came across it and I was like, what? Like literally they couldn't take like 3 minutes to ask me these questions. And honestly, like if I had been like, I've gone back in time and did the Edinburgh screening tool on myself, and I would have scored like off the charts, like off the charts. Like if they had just taken the time to just do that. And that's like really pathetic and sad,
It totally is. It definitely is. I mean, there's all kinds of issues with the reasons why screening isn't done in general. What are your thoughts on why racialized women are not being screened or not as much?
Well, one of the reasons is just because maybe they don't score on the fact that they have those risk factors because, they'll be like, no, I don't have any mental health history in my family. That's really, you didn't know you had a mental health history because it's conceptualized differently in your community or, in your family, or it's just, it wasn't talked about in that way. And another reason I think is that I think that profiling has a lot to do with it too, in terms of how healthcare providers see different communities. Like, I don't know, Kat, if you know about something called BB syndrome. Have you ever heard of that? BB syndrome? So BB syndrome is this phenomena that's like this way that UK health care providers have this little label that they attach to South Asian women. And it's a very sexist, racist way of describing women who they think, particularly South Asian women, who they think exaggerate the extent of their symptoms. So they'll be like, oh, you got somebody with BB syndrome in room 1. It's like automatically like assumed that this woman is like hyper exaggerating her symptoms just to get attention, like this kind of thing. So I think that there's a lot of like profiling of like, of different racialized communities. Like, there was one study, I believe, where they said that like medical students or like, I think it was medical students thought that different races perceived pain differently. And, like some communities could tolerate more pain than others. And it's just like ridiculous. So
that is a way long holdover of enslavement and racism.
Yeah, exactly. Like eugenics and stuff. And so I think that profiling has a lot to do with it. I think also the fact that, like, again, like different communities might talk about symptoms in a different way, right? So even in my own work, like I sometimes have parents that will call me and then they'll be like, no, my daughter's not acting like herself. She's not cooking. She's not cleaning. She's like this. And it's more on what she's not doing rather than the emotions that she's exhibiting. You know what I mean? So I think all of those things like come into play. Like there's some profiling, there's just different ways that symptoms are communicated. And then there's like the whole fact about like risk factors and, whether you know about your risk factors or not. These kinds of things all come into play. And then that's why I think universal screening is so important, so that you just like cut across all of that kind of stuff. And you're just like, doesn't matter if you're black, blue, red, or purple, you immigrated or you didn't immigrate, like you're all going to be asked these questions,
Yeah, absolutely. So I want to talk for a little bit and learn more about what you're doing as the Muslim Parents Coordinator for PSI. But in that role, I'm curious what you see specifically as negative impacts for Muslim parents in terms of perinatal mental health.
Okay, so in my role as a Muslim Parents Coordinator, I take calls from Muslim moms and parents that are experiencing perinatal mood and anxiety disorders and their families. And I kind of try to help to navigate the questions they have about being Muslim and having a perinatal mood disorder. So some of the questions that I address and I see coming up is that, they kind of wonder if having a perinatal mood and anxiety disorder or a mental health issue is somehow connected to a lack of faith, whether it's like evidence that they're not, as committed to their faith, they're doing something wrong when it comes to their faith. Another issue that I see is like, people kind of being like, I've been told that this is what's going on and I should seek help. But, kind of from a faith perspective, isn't all that I need to do is just pray to heal myself and get over it. And so, I'll get questions like that. And then I have people that contact me and they're concerned about, like how it's like viewed from a religious standpoint if they were to be going in and discussing their private issues with a therapist that's not maybe of their same background. Like, is that something that's bad? Because a lot of times, stress and stuff can be tied to why a perinatal mood disorder is manifesting. And they kind of feel like, is it bad if I'm talking about my junk with a therapist? So these are kind of like the questions that people bring to me and want help navigating around.
In your role as coordinator for PSI, are people talking about negative experiences they're having, like with the healthcare system or providers, because they are a Muslim parent through that lens?
Yeah. So I think that sometimes what I see happening is like that same kind of issue of where like profiling is kind of getting people dismissed. And sometimes it's meant well, I think, but it's like kind of like overcompensating for having a lack of cultural competency from before. So for example, I've seen cases where like Muslim women may go in and they're like, oh, I'm hearing like voices. And I think that pretty much I would think that should be like a tip off to any mental health provider that maybe this person is like, hallucinating or should be examined for psychosis. But then it's like they're overcompensating and being like, well, maybe this is part of your like cultural tradition, like immediately running to that, right? Yeah. So, and it's like, and then that person, if they're in a delusional state, they might say, yeah, it is, because they might feel like it is a religious experience. You know what I mean?
Sure. That gets really sticky.
Yeah, it gets into like a sticky thing. So I think that like it's really important for mental health providers and doctors and stuff to know, like, if this isn't part of their normal baseline, like they don't regularly hear voices like outside of the postpartum period, I think you should always view it as an indication that that person is psychotic and not try to be like overcompensating. Do you know what I mean?
Totally.
So I see like, and not rely on that woman who might be in a disturbed state to tell you what her beliefs are, because that may be her beliefs at that time because of what she's experiencing at that moment. So yeah, so I've seen that kind of thing happening.
Yeah, that makes a lot of sense, the kind of overcompensating. In your role as Muslim parents coordinator, what are you hearing from families that are able to reach you and get support from you about just how beneficial it is that you are able to provide that support?
Oh yeah, they're really like, very, very grateful. They're very grateful to be able to connect with somebody that kind of understands where they're coming from and can address those issues from a place of like shared heritage, right? Mm-hmm. And because, I'm able to share with them things like the fact that like, when they're approaching me with like, should I just be like praying? And is it because of lack of faith? They're so happy that I can give them information about how like historically the Muslim community or the Muslim world viewed mental illness, and the way that it's always been viewed by the Muslim world is that it's exactly the same as a physical condition. You're expected to seek help. It's not perceived as like demonic possession. It's not perceived as evidence of a lack of faith. And this is why, like, I'm able to share with them that facts, like the fact that historically it was Muslims that were at the forefront of pioneering the humane treatment of those mental health issues. We didn't shy away from engaging in talk therapy and taking medications, using music therapy and aromatherapy. And they're like, wow, I didn't know all this stuff.
That's cool.
And it's like, yeah, and it's cool. And then it helps them like understand that it's actually part of our heritage to seek help and use the tools that are out there. And it's not in conflict with our faith. It's actually part of our faith to do so. So then that kind of emboldens them and makes them feel like, oh, like now I know it. It's like my job to go get help for this,
That's and so much more empowering than feeling like there's something, wrong with you for having this really human experience.
Yeah, exactly. Anybody that I've connected through in this role, like I actually pitched the idea of this role because I was getting a lot of people would see my name online and then they would call me and be like, "Are you Muslim?" And sometimes like people call me and it's not even a perinatal mental health issue. It's just like a mental health issue in general. Mm-hmm. And so it's been very good. It's been very nice for me to be able to give that kind of information to people, make people feel comfortable with seeking out help and care and returning to their baseline.
Absolutely. And it so much speaks to the need for you in your role and for people doing things like you're doing. I mean, there's no way to get around how powerful it is to have somebody who gets you on this really foundational level.
Yeah. And I think that that's one of the most powerful things that PSI does, because it's easy for somebody to hear, another person say things like, you should go on medication, you should do this if you're having this. And it's a whole other level for somebody to say, you know what, I had this, I did this. And then it's like, right. Oh, it's not like you're being talked down to. It's like, totally. So that's one of the things I love most about PSI. I know this is not an advertisement for PSI, but, but that's what I feel. And that's why women and parents that contact us, they feel comfortable because they know you're not like a doctor. They know you're like one of them. Do you know what I mean?
Absolutely. Yeah, for sure. You can almost hear it. A while back, I was a coordinator also. And you could just almost hear it immediately when somebody feels like heard and understood. And I assume some level of safety, how much more relaxed they are, or at least feeling like there's a path to healing, a little bit of magic.
And that's why, even when I was asked to join the advisory council at PSI, I was like, can I still be a coordinator? Because I get all the good feelings from being able to, on the ground, connect women and families to resources and just being there for them,
That's awesome. Yeah. Thank you so much for the work that you do and bringing your voice to the writing and also your advocacy, because it is so incredibly powerful and you're attending to a huge need in the advocacy and the work that you're doing. So I appreciate you. Thank you so much.
And thank you so much for giving me the opportunity to share a little bit about it. Thank you, Kat.
Absolutely. Thank you, Hadra, for being on with us. And for those of you who listen today and are interested in getting more involved with volunteer work in perinatal mental health, you can go to postpartum.net and look on the website for different volunteer opportunities that are within PSI. And for those of you who are needing a little bit more support, PSI also has a directory to find perinatal mental health therapists and a ton of online support groups and other resources. If you individually are looking for support but can't quite find a therapist yet, I do offer online courses for postpartum moms. And you can find those on wellmindperinatal.com/courses to help you try and understand a little bit more about what's going on for you and get some really useful skills that you can use right now. Those courses are on demand and you can use them at your own pace in your own time. I thank you so much for being with us today. Until next time. Please find the Mom and Mind podcast on momandmind.com or wellmindperinatal.com, where you can also find access to my free online mini course that is specifically designed for people experiencing anxiety in the postpartum period. Or you can learn more about the 3.5-hour self-paced course that I created just for managing postpartum stress. You can also connect with us on social media at Mom and Mind on Instagram and Facebook. Thank you for tuning in and learning more about perinatal mental health.